Okay? Next is spinal cord and superficial or regenerating nerve. So Ari, amon siyang one of the precautions, no? Nga, let's say for example, irritating low back. Okay, so for example, this is the back of the patient. This is the area of the spinal cord. So let's say for example, treat ka di sa muning area. So treat. And then actually ang sa ano ba yun? Ang sa chart is both low back. So what do? You split them. So you make this, let's say for example, for both low back, bihambal niya 5 minutes lang. So you do it 2.5 minutes and then this one 2.5. Do not use the whole 5 minutes for both. Nga matreat ka di and then silo ka naman di. No, this is wrong. So what we should do is treat this first and then tapuson mo na yung 2.5 and then you treat naman this area. Tapos tapuson mo siya sa 2.5. Hindi mo siya pagdunganon nga 5 minutes tapos malakang-lakang ka sa piyak. Because there are researches that show nga may effect siya sa spinal cord and that it can actually affect no ang impulses nga ginasend sang spinal cord sa aton nga likod. Okay? So bawal ni siya ha, bawal ni siya. So dapat unahon danay ang one side and then when this side is done, you will proceed with the other side. Okay? Same with sa upper back, no? Same with sa diri nga area. So una anay ang piyak and then the other one hindi pagdunganon. Alright, so let's go to your phonophoresis. So this one is one slide only, no? So basically, your phonophoresis is the use of ultrasound to drive medication towards the tissues. Okay, so tungkol kay may acoustic energy siya it would push the medication no towards the tissues. So may amo man nga technique no in your TENS and in your ES. So depende na yan sa cathode and anode. So if it is negatively charged or positively charged. So amo na iya sa electrotherapy. But for phonophoresis, direkta lang gid siya. You won't need to see if it's positively charged or negatively charged. So any medicine that will be prescribed by the doctor, pwede siya sa ultrasound. Okay, so the application of US to enhance the absorption of topical agents. So it can be used by either pulsed or continuous. So pwede siya, either both. The mode. So the most common meds no are being used are your hydrocortisone and some analgesics such as your salicylates and your lidocaine. Okay? So especially for patients who are on acute pain, usually ginaresita na sila sa analgesics, topical analgesics nga pwede for phonophoresis. And then you can mix this with your aqueous solutions, your aqueous gels, and then perform ultrasound. Okay, so that's it for your ultrasound and phonophoresis. So any questions? Okay, guys.
Yes,
any
hello.
questions? Yes, hello.
Morning po. I have 4 questions. First
Okay,
is,
sige, go.
kapag po sa far-flung areas, tapos expired na yung gel, for example, tapos hindi ka makakuha ng pangpalit, can you use the expired gel?
No, as much as possible, no, don't use expired gel kasi ang experience ko with expired gel is bako siya and expired gel may cause irritation sa skin sa patient. So better use better use water, okay, for that area. Or let's say for example, ang area is shoulder. So shoulder, you can use mineral oil. Okay, so kung wala na gid gel ha, pero as much as possible, try to for far-flung areas, try to i-check gid nila kung may availability of the gel. But if wala gid and immediate gid nga need ang ultrasound therapy for that patient, you may use mineral oil. But mineral oil can heat faster. So dapat ano lang siya, ang immoderation is lesser, and then hindi mo pag hindi mo pagdasigon gid ang ang movement, but make sure to move the ultrasound head. So you may actually use your mineral oils.
Yung mineral oil, miss, na Johnson's Baby, ganun?
Yes, you can use that, but I don't know if gin ano sa inyo, gin incorporate sa inyo massage before ang mineral oils, because
Meron,
there
miss. Pero,
so you use those mineral oil nga ngalan niya lang gina is mineral oil. So you can buy those from mga pharmaceutical companies na. Pero you can use baby oil man. If wala na gid ha, that is your last resort ang mineral oil, but as much as possible no, avoid lang because mineral oil tends to heat faster. Okay, and basi masunog ang skinny patient.
thank you po. Second question, miss, is regarding cavitation. Do we want cavitation to happen, or is it just an expected part of the procedure na we can't do anything about?
Okay, so cavitation, no? With cavitation, um, it's it's already an effect that is being produced by the ultrasound, no? It's a non-thermal effect, but this is in theory, ha? So this was not, or this is not proven by research yet. So you actually don't have any means to know if there is actually cavitation that's happening.
Hindi
Okay?
siya visible, gali, miss. Like when you're doing
Hindi
the
siya.
procedure, you can, okay. Because I thought
No,
mag-bubbles.
no, wala siya ga-bubbles ha. Even doing underwater immersion technique, no bubbles. So wala. So the cavitation actually happens internally. Kuno. Based on theory, it would happen internally. So the gas bubbles would form sa joints, sa tissues na.
Okay. Third po, miss, is
Okay.
when we use ultrasound, can it cause infertility sa males when performed over the testicles? Or hindi man?
Yes. Yes,
Okay.
yes. Because heat, 'di ba? Heat would tend to kill the sperms. 'Di ba your testes, they are the area wherein your sperms are your sperm is formed. So 'di ba, in general knowledge, heat would cause death of your sperm, and if dira nga area no, or within that area gina perform ang procedure, this could cause infertility.
First, miss, is kanina, in pregnancy, contraindicated siya, pero if it's far from the uterus, it's a precaution. Kapag, miss, over the epiphysis, say, if it's not over the epiphysis, then can it still be used for children? Like, since far naman from the epiphyseal plate?
Actually, amuning dispute no, because I have my experience man po wherein they use that for children, especially CP patients. Your CP patients, so they have spastic hamstrings, spastic gastrocs. So there was actually a time na ginuse siya for the kid. What we did was to use a lesser a greater frequency nga ultrasound head, and then we concentrated that on the muscle lang mismo, and then gin-increase namon ang gin-increase namon ang iyang coupling medium or your gel, and then we decrease the time, so very minimal gid ang time na gin-use for the patient. Okay, pero as a general rule, as a general rule, though, bawal gid siya. No? So, if pwede siya i-avoid gid. But, like diri sa Philippine settings, and that time, so don't need gid siya kay very spastic na ang lower extremity ni patient. Okay?
Super last question, sorry.
Yes, okay lang.
Pag i-turn on yung machine, miss, normal na may sound or expected dapat na walang sound?
Wala sound. Wala siya sound dapat, the whirring or something, wala. Okay, so ano gali, no? So we still have time. Do you, I will present, no, ang ano, video gali. So tell me if makita nyo. Okay, so amula na siya. Wala ka dapat sang sound nga may mabatian sa pag-on sang machine. But for ano, for content nga ano no, so I will show you na lang how it is being performed. Okay, so tell me no if you can hear. Okay. Excuse me. Can you see? Can you see? Can you see the video?
Yes, miss.
Okay. Can you hear? Can you hear the audio of the video? Can you hear the audio of the video?
Why pa man, miss?
Oh, pero kagina, may nabatian ka mo wala.
Meron, miss.
Okay, sige. Start ko na ha so that we can see. So this is your ultrasound machine from ano no, from Qualimed. So si Miss Pao nyo, she was very generous in doing this demo, okay? So you plug first. And then ang switch sa likod. And then, nag-on na siya, no? Okay, so ara siya ang mga you need to, mga adjustables nyo. So your duration is 5 minutes. So your intensity is 1.5 watts. Okay, so ang iya duty cycle, as you can see, no, 100%. Okay. Okay, and then on. Okay. So muna siya. So when you off, okay, so ang part 2 sang off is here. This is the part 2. Okay, so mag-off. Switch lang. No need to change the intensity and then the duration. And then unplug. Okay, aftercare. Alright. So, mula na siya. So, wala kita nakakuha sang video on how to perform it. But I will be showing you how to perform sa laboratory. Because I have may na-acquire ako nga portable lang portable nga ultrasound. It's not as powerful as your machine gid nga big. And sa portable ultrasounds usually pre-programmed na ang intensity, everything is pre-programmed. So tapos 3 megahertz lang siya. So, hindi siya very effective if you want deep penetration therapy. Okay, so I will be teaching you techniques more on sa laboratory na. But for now, I hope you learned a lot, and with the video. So, ang sa video, I will be posting man along with the lecture. Okay, so any more questions, guys, before we end? Because we still have 10 a.m. class, I think.